Hi, and welcome to another episode of Hot Takes with me, the Silver Fox. We all know the NHS is in a very bad state, and it's going to get worse. And one of the reasons is all the doctors are leaving. That's assuming that any doctors come to Scotland or any doctors are trained in Scotland. But those doctors you currently have will be retiring early or leaving. And the reason, of course, is partially down to the taxes that they have to pay. We're going to have a look here because the senior doctors in the country are actually saying outright, deliberately, and without any question of doubt, it is a question of economics, a question of Shona Robinson's direction in terms of economic policy that will drive many doctors away from the NHS and make life almost intolerable for the vast majority of Scots. Let's take a look to see how much worse everything is about to get. Here goes. So Scots doctors quitting jobs before retirement age as they dodge the SNP's high punitive taxes. Well, it's undoubted, and we've said that this would happen. We said that doctors were the ones that are like prime in that 75 to 125,000 tax zone. Plus, of course, they're being taxed higher on every rate up to that point. And it's these people that will be driven out. They'll be driven away. Now, a doctor in Scotland can quite easily up sticks and move to England. England's got a shortage of doctors as well. They'll be only too glad to see them come south of the border. But what does that do for the poor people in Scotland sitting on a waiting list or trying to get in to see a GP? It's just not going to happen, is it? And the whole of the NHS will start to crumble and collapse, and people will die. This is doubtless, this is unquestioning. People will die as a direct result of Shona Robinson's policies. And she knows this, and she's still done it. Therefore, she is compliant and complicit with the deaths of probably tens of thousands of people. Deliberate policy deaths. The Scottish Government was blasted over revelations that only a small percentage of doctors work until retirement age, with poor pensions and high income tax labelled as reasons for this. Calls have been made for urgent action after it was revealed that top doctors are quitting before the retirement age in Scotland. Just 2.8% of medics who've retired since 2015 waited until state pension age to do so, figures show, and who can blame them? When the taxes are so high, when the punishment for working is so great, why put the effort in? Especially if you've got other arrangements made and that you can get by until the pension cuts in. I don't blame them, but it is leaving a terrible problem behind. But it's not a problem that the SNP want to sort out. They know they'll be gone in a couple of years. It isn't going to be their mess. It's been claimed that the Scottish Government's income tax cash grab is one of the reasons why the practitioners are leaving the industry earlier. Scotland is the highest taxed part of the UK, and with the tax divide with England especially huge for high earners, and come March likely to get much, much worse. Data obtained by the Scottish Liberal Democrats through Freedom of Information requests show that 2,062 GPs, or doctors generally, retired early compared to 60 who stayed on. So 2,062 retire early, only 60 make it until their pension age. And you have to ask why. The Scottish Public Pensions Authority figures show 185 medics retired early in 2015, and that number reached a high of 309 in 2023. Dr. Ian Kennedy, chairman of the BMA in Scotland, said, "These figures are illustrative of the warnings we have been making for some considerable time, that Scotland is risking losing senior doctors far too early at a time when its NHS can least afford it. Let's be clear, our NHS is on its knees." And as he said, he's warned them early, time after time, for a long time. They know what is happening. Shona Robinson knows what is happening, and she's continuing to do this. She knows her actions will kill people, and yet still her actions come. She knows that she is a killer. There's no two ways about it. There's no other way of putting it. If you know that your actions will lead to the deaths of people and you continue with those actions, you're complicit in their deaths. I think that she needs to be prosecuted. There's other ways they can make money, make savings that would help, and they're deliberately choosing not to do it. It is, as I say, death by policy. It needs to be punished by law. He says, continuing, this is Ian Kennedy continuing, he says, our members tell us that many of the senior doctors who work tirelessly and selflessly to get the country through the pandemic are now saying enough is enough. They're not just exhausted by the ever-increasing demands and poor work-life balance, but by a feeling of constantly being devalued, whether that be through punitive pension taxation, poor pay rises, or the recently announced income tax rise that will again reduce take-home pay and remove any incentives to do overtime. What's the point? If the government's going to take 70% of what you earn, why do you bother? Why do you put your own health at risk with the stress and the overwork for increasingly smaller amounts of money? Lib Dem leader Alex Cole-Hamilton said the data should send alarm bells ringing as the health sector struggles with eye-watering waiting times. He has urged the Health Secretary Michael Matheson to take action. Matheson can't take action. Matheson's locked in his office, staying out of the public gaze. You know, door closed, curtains down, iPad in his left hand, something else in his right hand, because that's all he's good for, isn't it? Mr Cole-Hamilton said, when the equivalent of 1 in 7 Scots is on an NHS waiting list, alarm bells should be going off in the Health Secretary's office. Everyone should be able to rely on swift and reliable care close to home. Should, but it isn't going to happen while this bunch are in charge. The only good thing is, if it's a lot of SNP people watching Granny die, watching their children die, they may suddenly realise that the SNP aren't everything. They aren't all that. They aren't the best people. They're not the ones that can be trusted to keep their family members alive. And they can look at Shona Robinson and say, Shona, you knew this was happening. Why didn't you put the money in? And she can say, I don't care about your children. Your children dying is a price worth paying for independence. Because that's the SNP way. So all you SNP voters out there, know that they have made deliberate choices that will kill people. Possibly your people, possibly your children. Just so they can keep embassies open that aren't embassies, fill them up with their mates and their families, wank away vast amounts of public money on that exercise of an attempted independence, which will never happen. And meanwhile, children, grannies, your wife, they're dying in hospital. But that doesn't matter. For them, it's, it's nothing. It is nothing to them. Collateral damage in their war for independence. Anyway, he says part of the solution lies in recruiting new staff, but many of these will take years to train. The Scottish Government should be doing far more to encourage the experienced and talent medics leaving the profession early each year to stay on. Well, you could pay them more. You could reduce their taxes. You could stop treating them like shit. He says part of that could involve embedding more nurses, dietitians and physiotherapists in communities so that people can get a wider range of diagnosis, treatment and follow-up within their community. This would reduce the burden on specialist practitioners, allowing them to focus on the most complex cases and encourage experienced professionals to stay. Why would they stay though? When you're taxing them 70% of what they're earning for overtime, why would they put the hours in and risk their own health for it? And this is what's happening. They don't care. They literally don't care. And of course, this is half the problem. And this is why so many are leaving. This is why nobody wants to stay within the health service. Because why should they? What would you stay with an employer who was forced to remove 70% of your salary and work so many hours it was interfering with your health, and being told, we're not giving you a sufficient amount to put in your pension, but if you go now, you're better off if you go early rather than work until you're 67 years of age. You can go at 55 and take your little private pension which will last you until, and you won't have all that worry and stress. I know what I'd do. I know what I've done. And they knew. The thing is, this is what gets me. The SNP knew this would happen. And still they did it. coming up. So just fast forward 5 years, 6 years, something like that. Half the doctors in Scotland have gone. Half of them gone. It's bad now. Half of them have gone. You're trying to encourage new doctors to come into Scotland, and you tell them, yeah, come up to Scotland. We'll do this. You have a great time. We've got all these facilities. And they get there and they go, oh yeah, right. And what's the pay? Oh, well, the pay's not as good as this and not as good as that. We weren't paying that much as you thought. You're going to be massively overworked because you've got nowhere near enough doctors. Oh, and we're going to tax you massively for the privilege. And that doctor will go, do you know what? I think I'll pass. Oh, there's a hospital in Bromwich, West Bromwich. I think I'll go there. Or there's a hospital in London. I think I'll go there. Or there's one down in Bristol. I think I'll go there. Doesn't matter where, does it? As long as it's south of that border. As long as it's well away from where he's going to pay high taxes, get treated like shit, have a massive workload, and where he's unappreciated by the government. What does that do to the people of Scotland? You've got a government actively killing you. Well done, SNP voter. Well done to you. I shall stop now. Thank you very much for watching. Do please hit the subscribe button, ring that bell, leave a like, leave a comment, please share the video. Till next time, stay safe, stay well, and I will speak to you later. Bye.